So as mentioned before, all the management practices that we have at Calving can have an impact on metritis, right? One of those is hygiene, and we need to have good hygiene to prevent contamination both of the birth canal but also of the calf. So basically, two different solutions that can be used to clean the vulvar region of the cow can be povidone or chlorhexidine. So Elisa, if you couldn't mind showing how this will need to be performed and how the perineum region or the area around the vulva is determined.
So the area around the vulva includes just beneath the base of the tail, out to the hooks on either side, and down to the mammary gland, which obviously we do not have on this model. You'll take a brush and scrub this area lightly to ensure we're cleaning any manure, anything else that's dirt and debris around this area off prior to the calving time. We also suggest using paper towels to gently wipe the area around and ensure that there is no contamination prior to calving.
Having good hygiene practices is paramount to prevent uterine diseases, but also having an appropriate diagnosis to prevent damage on the birth canal of the cow. So Dr. Newcomer, could you please explain us what are the 3 P's of diagnosis: presentation, position, and posture?
Sure. So we use presentation, position, and posture to really find out how that calf is oriented. And so when we talk about presentation, we're really talking about if the calf is coming forward or conversely if it's coming backwards. Most of the time we expect the calf to be coming frontwards, but certainly a certain number of calves, 5 to 10%, we do expect to be coming backwards. And a lot of times we will use the feet themselves of the calf to help us determine if it's coming frontwards or backwards. A lot of times on a dairy, if we see the feet sticking out and we can see the sole of the feet, we tend to think that calf is coming backwards. Whereas if we see the top of the hoof, we think that calf is coming frontwards. And that is true most of the time, but there's going to be some exceptions. And so to be sure, we would encourage y'all to go to the 3rd joint on the leg to determine if it's a front leg or a back leg. The first 2 joints on either the front leg or the back leg bend in the same direction. If it's a front leg, this 3rd joint will also bend in that same direction. As opposed to a back leg, those first 2 joints bend this way, but that 3rd joint actually bends the opposite way, and so that helps us determine that that calf is indeed coming backwards. So that's presentation. Is it coming frontwards or backwards? Our second one is position, and basically that just means if the calf is coming right side up, with the calf's back up pointed toward the sky, or if that calf is upside down, which is a lot more difficult, as you probably know. Okay? And this would be another presentation where now you see, even though these are the front feet, we're going to have the sole of the foot sticking out. And so looking at that 3rd joint will help us determine if it's coming frontwards or backwards, as well as the position. And then the 3rd thing we look for is posture. And what we're talking about when we talk about posture is just, are all the limbs coming as they should, or the head? A lot of times we may have one of those legs that are sticking back, okay? And so that leg is flexed and we need to correct that before we pull the calf. Same thing with the head. We can also have a head back. And so obviously that needs to be corrected before we pull. And so if you can remember the 3 P's, presentation, position, and posture, that'll really help you make an appropriate diagnosis every time.
And I cannot stress enough how important this is to not damage the birth canal. Imagine what will happen if you have a wrong diagnosis and you put the change on a front leg and a rear leg. Clearly, the calf is not going to be able to be expelled through the birth canal. Also in cows, you may see some cows having twins. If you have 2 calves engaged simultaneously on the birth canal, and one calf has each forelimb engaged in the birth canal, if you place the chains and start pulling and try to get both calves simultaneously from the birth canal, you're going to damage the cow and the birth canal. Besides hygiene and having an appropriate diagnosis, providing enough lubrication is paramount also to prevent damage of the birth canal. Could you guys please explain the type of lubricant that we use and why it is important?
Cows have a lot of natural lubricant, up to about 4 gallons of their fluids and their fetal fluids that actually assist you during a dystocia correction. The other thing we can add in is actual artificial lubrication that can be extremely helpful in pulling a calf. This, in comparison to the price of the calf and or treating a cow or losing a cow due to damage during dystocia correction, is extremely cheap and a very efficient method to assist your correction and pulling of a calf.
And an important thing, as Alyssa mentioned, why we start with 4 gallons of lube. As the dystocia goes along, we're going to lose a lot of that fluid. So it's important to replace that with lubrication as we're working.
One type of dystocia we may have is fetal-maternal disproportion, which is we have a calf that is way too big for the size of the birth canal of the cow. And this one happens especially in prepartum heifers. So let's say we bring this heifer to the chute. What is the first step that we need to do once we have all our PPE?
So the first thing we're going to do is clean, as we previously discussed. So we have our diluted chlorhexidine solution and our brush, and we're going to clean from the base of the tail down through the pins and all the way down to the base of the udder.
Next, we're going to evaluate the posture and the 3 Ps, as we previously discussed, to determine the presentation of this calf. With 3 joints all bending in the same direction, a head and both limbs out, we're actually corrected upwards and we're coming out in a normal presentation here. So next, I'm going to be placing the chains as I've made an appropriate diagnosis. So I pull my chains from the chlorhexidine solution that was in. You're going to take this loop, pass this chain through. I like to put them on my fingers right here, and I'm going to slip it up above the fetlock joint here. I'm also going to make a half hitch and place it on the loop below, a loop below the fetlock. It's imperative to place 1 loop above and 1 loop below, because if we are not doing that on the fetlock area, we can break a limb with extreme force.
Then you can place your handles. Dystocias always work best if you have 2 people, someone that's putting on the change and then someone that can help assist.
So I'll place this one the exact same way, pull my loop through, put it around my fingers, pass it over the foot and above that fetlock joint, tighten down, make a half hitch, and put 1 hitch below the fetlock joint as well. And again, if those chains slip at all, we just want to make sure there's 1 above and 1 below that fetlock. And at this time, we're ready to pull.